to you by Express Care Health and Skin Center. Get in, get out, get better.
All right, welcome back to Healthy Living Tuesday, everybody. We are talking about pituitary glands, and for good measure, we're going to throw in the pineal glands, which Dr. Jitka Lom from Express Care was alluding to earlier. So there's a lot going on right behind the bridge of your nose.
Exactly.
And this is something that lasts all the time. I am extremely educated for this one, but people way smarter than I, of course, are asking smarter questions than I ask, so let's go ahead and get to those. You ready?
Yep.
All right, here we go. Question number one, gentlemen, if you would. Laura from Telepago asks, how do you decalcify the pineal gland, Dr. Lom, and is it safe?
Oh, well, you know, one thing that happens with the pineal gland, that's the one that controls the melatonin and helps you go to sleep at night. The pineal gland will calcify even in children, but certainly by the time we're sort of middle-aged, most of us will have a calcified pineal gland. And that's really okay. But it does maybe affect the fact that elderly people don't sleep so well because, you know, they don't maybe make as much melatonin. So do you need to decalcify it or do anything about it? Probably not. I think that's more in the realm of a naturopath or sort of alternative medicine to try to decalcify things. It's probably not necessary at all.
Now, are the melatonin pills that you can get over the counter, are those more of a placebo, or do those actually have?
Those are actually the identical hormone that your own body makes. So it's a very excellent way of helping yourself sleep, especially if you're a shift worker or jet lag or whatever, when there's a problem with light and dark and you're sort of messed up on the night and day. So you would take some melatonin, 3 or 5 or 6 milligrams before bed.
I did not know that about elderly people, that they don't sleep well. Thank you for that. Yeah, that's interesting.
Yeah.
Okay, Jonathan from the island's capital village of Agana asks question number 2, and Jonathan asks, Dr. Lom, is fluoride really harmful to the pineal gland?
Oh, well, fluoride is one of the things that will help it calcify. So some people believe that if it's calcified, it's not functioning as well and so on. And but you should still brush your teeth and get fluoride treatments, definitely.
Yes, everybody out there should brush your teeth. Please, everyone listening to me, please brush your teeth. Yeah, so fluoride good for your teeth, but not so much.
Maybe everything in extreme is not healthy. So sometimes in some areas, on Guam we don't have fluoridated water, but in some areas of the United States they have a lot of fluoride in their water, and then you might have problems with calcification, including problems with mineralization of the bones. But here on Guam we don't have to worry about that.
All right, so you heard it from the doctor.
Just get a fluoride treatment.
All right, everybody,
use proper toothpaste.
Brush your teeth. Everybody at KUM, brush your teeth. All right, question number 3. Is it true that organic foods are better for my glands than conventional food? And this comes from Dedido from Mark.
Well, you know, I think as far as remembering that we are what we eat. When we eat foods that are whole, healthy, and maybe very fresh from our backyard or from the market, we're going to do better than when we eat processed foods that aren't from a package or have been shipped in from elsewhere. So always try to eat fresh fruits and vegetables for all the good reasons that they have to help you.
Simple as that.
Yeah.
All right, very nice. Okay, we go to question number 4, and this comes, last question was from Dedido. This one's a little bit more up north from Jigo, and this comes from Vic. And Vic asked Dr. Lom, does natural butter oil and cod liver oil really benefit my pineal gland?
I'm not aware of that. I don't think it would necessarily benefit. The pineal gland, again, is a very ancient gland that sits in there, does its own thing. It doesn't really need any help of any kind besides hydration, because it's actually full of water. It's way in there and it's full of water, so you need to stay hydrated, that's it.
And of course you hear about the health benefits of omega-3, like if you eat certain types of fish. But
right, that's more like anti-inflammatory for your entire system, very healthy. Eat your omega-369s for your heart health and for your overall anti-inflammatory general health.
All right. Nice job. Okay, I am sure I'm going to butcher this word, but Norma from Talafofo types, what is hypopituitarianism?
Oh, very good. Hypo, anything in medical speak means less or lower or deficiency. So hypopituitarism means you have less pituitary gland function than you should have. And again, we just talked about that a little bit earlier on, where maybe through a stroke or a brain tumor or through extreme blood loss, your pituitary gland might have suffered enough that it's not producing the amount of hormone that you need of all the different 8 hormones that it produces. And then you might have different symptoms, including infertility, problems with breastfeeding, problems with growth, problems with menstrual periods, problems with your thyroid, so many different possibilities of problems that can all be tested with blood tests. So it's really remarkable that you can assess that tiny little gland in your brain through the blood.
Anything life-threatening?
Yes, sometimes it
Okay.
can be life-threatening, yes. If your pituitary gland is completely wiped out, it is life-threatening. And at that point, you would need to have supplements of all kinds of different hormones that you can take by mouth as in pill form. You can be supplemented. All those different hormones can be taken in pill form.
Oh, okay, well, you've mentioned tumors before, and for the last question, we go to Joshua from Itarahan, and he asks Dr. Lom from Express Care, what are some symptoms of a pituitary gland tumor?
Okay, well, we briefly talked about that. It depends on which hormones the pituitary gland tumor is affecting, but if it's a very large tumor, it's pressing, and so you're going to have a headache right here and maybe the double vision you talked about. Besides that, if it's affecting the production of any particular hormone, for example, you could have a tumor that's causing you to end up to produce too much testosterone, then you would have if you're a man, maybe excessively aggressive personality, but besides that, if you're a woman, you might have funny hair growth on your face, you might have problems with your menstrual periods and so on. That's just one example of one hormone that might be affected.
All right, long story short, go see the doctor and go see people like Dr. Lom over Express Care. Before we go, is there anything going on in Express Care that you want to give people a heads up about?
Well, we're just happy to help you with anything that you need, from skin to hair removal to any health problem you might have.
All right, well, she is the nicest person in the world. It's not just nice TV lighting and sound and everything. She is as cool in real life as she is on TV. So Dr. Lom, thank you as always.
Thank you very much.
All right, and stay tuned because Healthy Living Tuesday will continue on the flip side of this break.